How would you like to not just look younger, not just feel younger, but be younger? That's the promise of regenerative medicine and stem cell therapy with our aesthetics program. Hello, I'm Dr. Bryan Schuetz, and today I want to present how stem cells are changing the world in regenerative medicine and aesthetics. I'm going to show you a brief video to start our presentation tonight. It's a cute video about a person who went in to get stem cell therapy, and she talks about how she's getting stem cells from a baby. The truth is, the stem cells that we get come from the umbilical cord after a healthy delivery. These are where most stem cells are concentrated, so we can use them for regenerative procedures, for facial procedures and hair restoration procedures. So I'm going to show you this brief video, and then we'll continue.
So they take the stem cells from a baby and they put it in your face. That's right. I'm gonna get baby stem cells injected into my face. These baby cells are gonna give me plumper skin, less wrinkles, and a youthful appearance. Okay, somebody bring me that baby. Hi, baby. I'm gonna borrow some stem cells from you and put your baby essence into my skin. So I'm here at Goldenberg Dermatology, where I'm gonna get my umbilical cord baby stem cell injected. And I think we should go meet the doctor and suss all this out. Hi, how are you?
Christina Goldenberg.
Dr. Christina Goldenberg, nice to meet you. And Dr. Gary Goldenberg. They're married. So I'm ready. Tell me about this revolutionary new technique that we're doing today.
Stem cells from umbilical cords.
Umbilical cord baby stem cells.
Basically, what these stem cells are doing is they're activating your body to produce natural collagen. So by the time the filler wears off, you have your natural skin producing collagen to keep you looking youthful and radiant.
These stem cells are so early in the development. They're so brand new. When they're injected into your tissue, they look at the environment that they're in and they help your normal cells to regenerate and renew. So they're going to actually produce collagen as they would normally in your body, and that collagen, once you make it, it's yours to keep. It doesn't go away like fillers usually do.
Oh yeah, just put that stuff right in my face. I'm fine with that. Do we have a time limit here? Is the stem cells are getting older as we speak? Because we don't want that.
Stem cells are on ice, so they're good.
Okay, phew. Stem cells on ice. That's usually the way I like my baby stem cells, over the rocks. Okay, let's inject some baby into my face, shall we?
I'm keeping the injections high in the skin because I don't want to droop the eyebrow or the eyelids.
What do you know with that? It's worse going to the dentist, to be honest with you.
Oh my God, thank God you said that.
Yeah, no, the dentist is way worse.
My whole goal in life is to be better than the dentist. Smile. Very natural.
Beautiful.
Very natual, correct.
I don't know, because I don't have a mirror. Yeah, that's good. Does not look crazy. Now's the time, babies. How many babies are in there?
So you're going to get a total of 2 cc's. There's 1 cc of core site product, which is the true stem cells. There are over 1 million stem cells that you're getting.
1 million stem cells. And they're going to go in and start doing their magic.
Correct. Whenever you're ready.
I'm ready. I feel
Just
like
got 500,000 stem cells injected.
500,000 stem cells. I got lots of babies in my skin. Yeah, I've never seen a droopy baby.
No.
Never. I've never seen a tired baby or a droopy baby. I mean, I've seen tired babies, but they don't look tired. Thank you. I'm very excited. Thank you. Ice pack, please.
You're a great patient.
You are my new favorite doctors.
So as you can see, it's a very easy procedure and it has permanent results, which is very important. So we want you to feel younger. We want you to actually be younger with your regenerative procedures, just like the young lady in the video. Now, the last few decades, we've come a long way in how we've used stem cells for regenerative procedures. We started off in this country with skin, actually, with burns and wounds that people had, and they could actually regenerate those tissues with the use of stem cell therapy. We then moved on to doing joints, and joints have been very prolific in this country. We have thousands of people in our clinic that have been treated for stem cells with arthritis in their joints and such. It makes a huge difference in their lives. But once we started doing aesthetic procedures, That's when people really got excited, because it seems like people want to look better before they even feel better with their joints. So we do a lot of people with regenerative procedures to help them with their face and hair restoration. Now, why does your skin age? That's a very important question. You'll see your whole body ages over time due to lack of stem cells. As you get older, your stem cell production is reduced. Now let's look at someone's lifespan over a 90-year period. So the first 30 years, we have minimal aging. That's because our stem cell production is very high. Stem cells are extremely important even when you're in utero, because everything that you become before you're a baby, a fully formed baby, are stem cells working to create your organs and tissues in your body. They then stay on after you're born, and they're very prolific in creating lots of new cells so you can grow into an adult human being. But then into your 30s and 40s, we start to see a reduction in stem cell production occurring inside the body. From age 31 to 60, we really start seeing visible signs of aging, with loose skin, wrinkles, dry skin, and these sort of things start to show up because stem cell production is reduced over time. Now, from age 61 to 90, this is where we really start to see the changes accelerated. Start to see things like extremely loose skin, the wrinkles get deeper into the skin, and we start to have problems with the skin actually thinning, and that's a big problem for a lot of people as they get in that age range from 60 to 90. Now, here's a graphic representation of the stem cell production inside the body. We start out as a newborn, and 1 in every 10,000 of your cells is a stem cell. That's because they're having to grow new tissue as you mature into an adult. Now, when you become a teenager, we now have 1 in 100,000 cells are a stem cell inside your body. So we're starting to slow down at that point, but really we don't see signs of aging yet. Now, when you get to age 30, it's 1 in 250,000 cells that's a stem cell. By age 50, it's 1 in 400,000 cells are a stem cell. And when you get to age 80 and above, it's 1 in a million cells are a stem cell. So those cells, remember, are responsible for maturing and creating new cells inside the body. When we have less of them, we have less new cell formation. And that's why we see aging in the body. On this next slide, you'll see that as a newborn, one of your stem cells will divide every 28 hours and create another stem cell. So at the end of a month, you actually have 1 billion stem cells from one of your stem cells inside your body. Now, as the next slide, you'll see at age 35, one cell will divide every 48 hours. When that happens, over 30 days, you come up with a total of 32,000 cells, instead of 1 billion cells like you did when you were young. Now at age 65, one cell takes 60 hours to divide. At that rate, at the end of 30 days, you have 200 cells that you've created from that one stem cell. And this is where we start to see the visible signs of aging really take over. Now, the future of medicine and regenerating tissues is through stem cell therapy. And the amazing thing about it is, you don't just look younger when you have stem cells put into your body. You don't just feel younger, but your tissues actually are younger. Okay? It's totally different than having any kind of plastic surgery, which doesn't do anything to regenerate the tissues in your body. Also using Botox. That's just simply botulism, and it actually paralyzes muscles in your face so that your wrinkles don't look so bad, but does nothing for the skin. And then, of course, we have fillers and things that have to be redone. They just fill in the wrinkles. They don't really regenerate anything. Okay, stem cells have the ability to go into your skin and actually change the structure of your skin like it was when you were younger. It's very exciting news for a lot of people in this country. Now, when you look at regeneration, I like to use the example of a lizard. How if the lizard loses its tail, it'll actually grow a new one. To bring forth, again, is what regenerative medicine is all about. So we're bringing forth new tissue in the body, in this case, new skin or new hair, so that you don't just look younger, you actually are younger than you were before. Regenerative therapy has been around a long time, like we talked about, but right now we're engineering these tissues so that they're even better at doing the job. We have two different tissues we use in our clinic. We have acellular tissue, which are simply extracellular matrix of the cell would normally live. We can put that into the body with the stem cells, the living stem cells, so they can go in and regenerate tissue very quickly inside the body, and the changes are noticeable right away. Now, is it regenerative medicine and stem cell therapy are the same thing? Regenerative medicine uses stem cells and those acellular products together in concert to give you the best results when you're undergoing these kind of procedures. And cellular therapy is the part where the stem cells come in, okay? So we've given you the matrix of the stem cells that naturally live, then we give you the stem cells so they'll be able to grow more extensively inside your tissues more quickly. So you'll see very quick changes and long-lasting changes. Now, the stem cells will continue to divide, we know, for up to 7 years after injection. And at the end of that time, it's not like the skin just goes back to where it was, because you get to keep your skin. That's the good news. After you go through these types of procedures, you actually get to keep the tissues that you've built over those 7 years. Now, when we're born, we have the highest concentration of those stem cells. So we want to do everything we can naturally to keep them in good shape. You want to take care of your skin. You want to be careful with sun exposure, keep well hydrated, take the proper vitamins and minerals and those sorts of things so that we can get to an older place when we're in our 40s and our 50s and our skin isn't so damaged, so we don't have that much to do. But I'm going to show you the way we evaluate your skin to see the damage you had before we do our therapies in just a few moments. Now, what can stem cells do? This is important because the first thing they do is they reduce inflammation. A lot of changes in facial tissues are from damage from the sun, from chemical exposure, from all sorts of things in our environment that causes inflammation in the skin. So stem cells, number one, they reduce inflammation. The second thing stem cells do is they modulate your immune system. They help your immune system not to react. This is why we use stem cells to a lot of patients who have psoriasis and those sorts of things, because it'll help the immune system to control the body better, and you have less reaction when you have any kind of breakouts. Now, they also reduce scarring. So if we have a person with scarring, we can actually inject the stem cells and the extracellular, non-cellular tissues into the patient, right into the scars, and we can actually see scars dissipate. So that's a very good thing that these cells do for our patients. And then we also regenerate tissue. It's extremely important. This is the best thing the stem cells do, is they work, it's not a magic trick, they work exactly like they did when you were young to build new tissue in your body, at the same rate that they did when you were a newborn. Because again, we get those cells from the umbilical cord after a healthy delivery has taken place. And the acellular therapy is there so that there's a medium for the stem cells to grow in. Again, it helps the procedures to work like they should and to get the best results. Okay, I really like this quote, and it says, "Aging is a fact of life. Looking your age is not." We all want to try to look and feel better as we get older, and that's the promise of having these type of regenerative procedures. As you age, you begin to lose vascularity in your tissues because you have less stem cells. Stem cells live at the end of your blood vessels on your capillaries, and that's where they start to be able to grow and to form new tissue. And as we lose those blood vessels, we lose the places where the stem cells can live, and we see aging accelerated in the tissues. Without those oxygen that the blood brings to the tissues, we're going to see again accelerated aging. Okay, so the stem cells, and when we build new blood vessels, and we have stem cells that are there with the extracellular matrix, we can actually renew the tissue to grow brand new tissue and overcome the damaging effects that you see from sun damage and environmental toxins that invade your face every day. The question becomes, how do we know how to treat your face specifically, or your hair problem that you might have? Well, that goes to a consultation in our office, where we will sit down and talk to you about your goals and give you an objective evaluation on the damage that your skin has suffered over the years. This is where we bring in the pair. The pair is our machine. It's a three-dimensional system that will photograph your face, and it actually has a lens that will look for UV damage under your skin before you can even see it. So we get to see the damage, and then we can evaluate what type of therapy would work best for you. With the pair imaging, we get to sit down with you and look at exactly what damage has been done, what kind of wrinkle problems you have, and any sagging skin. The pair will point that out for us and give us objective documentation of what we need to do to best help your case. Here are some cases that we'll show you now, where the pair shows underlying skin damage. You can see the dark spots in this particular lady's face on the left, and on the right, it's showing where she has extra sebum in her skin and some sagging in her skin as well. And it's pointing out those areas for us. Now, the other one, we're going to show where we have wrinkles, and we can point out the wrinkles and bacteria that might be in the skin. Will show up on the pair examination. One of the great things about this examination is we actually get to show a before and after, before you get the procedure. So we can take the damage and show it to you. Then we can show you what the procedures can do for you in a pre-treatment before and after case, which is fantastic. Then we can actually measure by taking a new image after you've had the procedures and see how they compare to what we thought would happen with our regenerative procedures. So once we get the area identified, we take the pair examination, we can then tell exactly where we need to inject in the blood supply to get the results that we want with your regenerative procedure. When using the regenerative treatments, we combine them sometimes with PRP, which is actually using your own extracellular matrix derived from your plasma that we put with the stem cells. We can use that as a procedure as well, and a lot of our patients do use that to get fantastic results. Facial rejuvenation. Now this is where we're going to do microneedling, okay, along with the stem cells and the extracellular matrix that we'll put in your treatment. When we do that, that will stimulate healing in the tissue, and some people call this the vampire facial. You'll hear that a lot. That's what the microneedling does. It actually stimulates healing of the skin, and with the stem cells in there, it really does a fantastic job, rather than just doing the microneedling procedure by itself. So what to expect: 30 minutes prior to the procedure, we put a numbing topical solution onto the patient so that we can go ahead and do this in a non-painful sort of way. And then 15 minutes prior procedure, the product is prepared for injecting. Now, once you start the procedure, depending on what you're having done, it could take anywhere from 15 minutes to 45 minutes to do a procedure, sometimes longer. It just depends on what we need to do for you. But we individually evaluate each patient, and then we know exactly what to do to get the most benefit. So how it works, there's 3 different phases. Phase 1 after treatment, the inflammatory stage, that's where everything's stirred up. That is going to last a few days. So you have a little bit of swelling and such. Now with the stem cells, they'll go in and take care of that swelling very quickly. So you only have that for a couple days. Phase 2 is when we have the regenerative stage. That's where you start to see the tissue regenerating, getting thicker, more full skin underneath, and less of the thin skin, dry skin, and that sort of thing. Phase 3 is remodeling, and this goes on for months. That's where the cells are regenerating the tissue, building new skin. All the way up from each level, you're getting new skin, okay? And that skin lasts for years. Again, the stem cells will keep it growing for years, and then after that time, you'll have the skin to keep. It's not like it goes away after the stem cells are done doing their work. Okay, so here's what Coco Chanel says. She says that nature gives you the face you have at 20. It's up to you to merit the face you have at 50. And when you're 50, we'd rather you look like you're 20. And here's some before and afters on patients. This is a close-up of the skin before treatment and after. And you can see the folds that she has in her nose, beside her nose. And you can see how they smooth out and get smaller. The skin is less sagging after the procedure. And if you look down at the skin, it actually looks completely smooth, where before you see the wrinkles in the top part of the picture. Here's a 61-year-old lady who on the left is her before picture, on the right is her after. Here's a 58-year-old lady, and you can see on the jawline on the left, she has some bowing, some dropping and sagging of the skin. Then on the right-hand picture, the after picture, you see that that is gone. Her folds around her nose are much less pronounced and more smoothed out. And this young lady at 63 years old, this is the before and after. You can see how the skin is not sagging in the jowls area around the jaw, and you can see around the eyes we have less of the baggage around the eyes, the sagging skin, and the skin looks a lot more toned in the after. Here's a close-up when we had a patient dealing with some acne scarring. You can see on the far left we have the pitting from the acne. Then we move to the middle picture. We're in the remodeling phase now, and we see as we progress over to the right-hand side, less and less of that scar tissue and that damage from the acne because the stem cells are regenerating the tissue. Here's one of our patients. This is a 3-week picture before and after. She actually sent her after picture to me when she was in Las Vegas. She was very happy with the results in just a very short period of time. Here's a hair restoration patient. We have the before on the left, after on the right. Again, stem cells can regenerate new tissue. In this case, we focused on the hair, and with great result. In this picture, you can see a hair restoration patient with a very thinning crown line around her head. And I'm going to show you this brief video where she talks about her results getting the stem cell procedure.
When you're a young girl and you start to lose your hair, you don't want to talk about it. And you don't want people to judge you about it. And now that I've had this done and I've gone through what I've gone through, I specifically tell people about it. I'm like, check this out, look at my pictures, look at my before pictures, check them out, because there is life after death.
Needless to say, that procedure works very well for hair restoration and for our patients who have skin restoration with the regenerative medicine. Now, the services that we offer in the office, we have the PRP, which is again using your own plasma with the microneedling. We use that to get the surface tension of the skin better and to stimulate healing of the tissues. We also use the stem cell facials. When we back the PRP and microneedling with the stem cells, that's when we get the best results. Then we use the PRP and the stem cells for the hair restoration. And we have different packages that we'll use depending on what your goals are and what kind of damage you have in your skin, so we can get the best result for you individually. We do offer aftercare products that are included with your facial and hair restoration packages. We include these in your packages because we know that they get the best results, and they are the best products on the market that you can use to protect and create new cells in your face and your hair as well. And here are the conditioners and shampoos that we have that we use with our hair restoration patients. So the next step is to actually have a consultation to see how stem cells and regenerative medicine can help you to not just look younger, not just feel younger, but to be younger. With that consultation, we'll actually do a case history. We'll see how your damage has gone over the years and things you might have had happen to your skin, maybe burns when you were younger and that sort of thing. Then we'll go over your medical history, see what kind of medications you're taking, how that might be affecting you. We'll examine the areas of concern, and again, we use the PAIR unit in our office. The PAIR unit is fantastic for objective documentation of skin damage, and then we can show you how your skin is better once we do the regenerative procedures. We'll then discuss any recommendations we have with you as far as treatment goes. Then we'll go ahead and answer any questions and talk about payment options so that you can get the procedures. The cost of the consultation is normally $299. If you sign up with our webinar today, we'll actually do the consultation, examination, and the PAIR unit. We will go ahead and do that for you for $49. Okay, so that's going to give you a really good picture of your skin's health, and we'll tell you what we can do to possibly help you. And if we decide that we can help you, we actually will take that cost of the consultation off of the cost for your regenerative procedures that you're going to have done. Remember, you're beautiful, you're strong, and you're worth it. And with our regenerative procedures, you're not only going to look younger and feel younger, but you're going to be younger. Okay? So have a great day, and thank you very much for watching our webinar. We hope to see you soon.